Have you ever thought about a condition that can literally take a child's voice away, but, only sometimes? Today, we're going to try and unlock the silence around a really puzzling condition, selective mutism. We're going to dive into what this complex anxiety disorder actually is, who it affects, and how it's treated. So let's just jump right in with the big question. Picture this, a child who's talkative, maybe even a total chatterbox at home with their family. But the second they walk into their classroom, they go completely silent. And I don't just mean shy, I mean silent. So why does this happen? That's the mystery we're going to unpack together.
Okay, so what exactly are we talking about here? It's so easy to just write this off as a case of extreme shyness, but it is so much more than that. This isn't a choice. It's a real, powerful manifestation of severe anxiety.
Right, here's the official clinical definition. And the key words you really need to hang on to here are consistently and specific social situations. This isn't a one-time thing, and it's not a global inability to speak. It's a consistent, powerful pattern of silence that gets triggered by very particular environments, like school or even a playground.
And this is where you really see that core paradox in action. In a place where the child feels totally safe, like at home, they can be that chatterbox. Everything seems completely normal. But the moment they step into a different social setting, boom, that silence just takes over. They won't start conversations, and they literally can't respond, even when they might want to.
So here's a really crucial point. The desire to communicate doesn't just disappear, only the verbal speech does. To cope, these kids often become absolute masters of nonverbal communication. We're talking gestures, pointing, writing notes, you name it. They have the language skills, and they're usually more than willing to jump into activities just as long as speaking isn't required. It's their way of managing this completely overwhelming anxiety.
So that's the what. Now let's take a look at the who. Who does this condition actually affect? Just how common is it, and do we know what the risk factors might be?
While selective mutism is considered rare, it affects a really small fraction of the population, somewhere between 0.03% and 1%. To put that in perspective for you, in a big elementary school with, say, 1,000 students, you might only find 1 or 2 kids with the condition. And this rarity is a huge reason why it can be so deeply misunderstood.
The condition typically starts really early, usually before a child even turns 5. But it often flies under the radar until they start school. That's a setting where, all of a sudden, the demands for social interaction and speaking up make the silence impossible to ignore. For parents, this is often that light bulb moment when they realize, okay, this is more than just shyness.
So what might contribute to it? Well, research points to a couple of potential environmental risk factors. For instance, kids who might already be prone to anxiety might model socially anxious behavior they see in their parents. Or an overprotective parenting style might, unintentionally reinforce the child's avoidance of scary situations. Now, these aren't definite causes, but they are things that are noted as increasing the risk.
So how in the world do professionals diagnose a condition that's this specific and this nuanced? Well, it's not just a guess. There's actually a very clear clinical blueprint they followed to get it right.
And that blueprint comes from something called the DSM-5, which is basically the official manual for diagnosing mental health conditions. It gives professionals a standardized 5-point checklist to make sure the diagnosis is accurate and that nothing important gets missed.
Okay, so let's walk through these 5 criteria. Number 1, the silence has to be situational. 2, it has to genuinely interfere with their life, getting in the way of making friends or learning at school. 3, it's got to last for more than a month, and that doesn't count that normal quiet period when a kid starts a new school. 4, it's not because the child doesn't know the language. And 5, this one is critical. Other possible causes, like a communication disorder, have to be ruled out first.
And this really highlights a key difference. With something like a communication disorder, say one that causes stuttering, that difficulty with speech happens everywhere, in all situations. But with selective mutism, the physical ability to speak is totally there. It's just kind of locked away by anxiety in specific settings.
But listen, a diagnosis is not the end of the story. Not at all. In fact, it's the beginning of a very clear path forward. So what does treatment actually look like?
This right here reveals a huge piece of the puzzle. The link between selective mutism and social anxiety is incredibly strong. In fact, they almost always go hand in hand. See, this isn't just a speaking issue. At its core, it's an anxiety issue. And understanding that connection is the absolute key to understanding the treatment.
because it's rooted in anxiety, the main treatment is something called cognitive behavioral therapy, or CBT. A huge part of this is gradual exposure. The goal is to gently break that cycle where the fear of speaking leads to silence, which gives temporary relief, but actually makes the fear even stronger next time. So a therapist, working really closely with parents, will create a sort of ladder of small, manageable speaking challenges, helping the child build confidence one tiny step at a time.
So what does the future hold for these kids? Well, the prognosis is genuinely hopeful. With the right support and intervention, most kids do outgrow the selective mutism itself. Now, some social anxiety might stick around, but the silence, that can absolutely be overcome.
And that brings us to a final thought. Understanding the clinical side of selective mutism is one thing, but it also makes you ask a bigger, more human question, doesn't it? What does it take to build environments, in our schools, in our communities, in our own homes, where every single child feels secure enough to speak, to participate, and to truly find their voice?
Okay, let's go.